First number I want to speak about today is the fact that we have 399 active cases of coronavirus across Victoria. That is the first time that we have had less than 400 active cases in our state since the 30th of June. And it's one measure among many of the amazing performance of the Victorian community. Staying apart but sticking together, making sure that we defeat this second wave, making sure that we continue to drive these numbers down. Because it's only if we get the numbers low that we can hope to keep the numbers low. And that's why I'm not only proud of the Victorian community, I'm deeply grateful to the Victorian community for the amazing work, the sacrifice, the pain that they have endured and will need to endure for a bit longer in order to defeat this second wave and then open up and stay open. I'm very pleased to be able to report that there are just 16 new cases since my update yesterday. And 10 of those cases are linked to outbreaks in aged care. 4 relate to a complex case. 1 is linked to both an aged care outbreak and a complex case. There'll be further investigations by our public health team around those matters. I'm sad to have to update you that there are now 784 Victorians who have passed away as a result of this global pandemic, 2 since my last report, 2 males in their 70s. 1 of those is linked to aged care. We, of course, send our condolences and our best wishes to those 2 families. There are 51 Victorians in hospital. 9 of those are receiving intensive care, and 5 of those 9 are on a ventilator. There are now a total of 2,661,989 test results that have been received since the beginning of the year. That is an increase of 10,680 test results since my last update. As I always do, because it's so important, can I thank all of those more than 10,000 people who got tested the day before yesterday. It's such an important thing. One challenge we face, among many, is to make sure that we keep having the largest percentage, the largest number of people in Victoria who've even got the mildest of symptoms coming forward and getting tested. Not waiting a day, not waiting at all. If you've got symptoms compatible with coronavirus, then you need to come forward and get tested. That won't hold us back from opening up. In fact, that's what we want. We want to know where this virus is so that we can support you and your family and so that we can stop it spreading any further. What might hold us back is if we don't have people coming forward and getting tested. That's still a strong number, but we want everybody who's got symptoms, no matter how mild they are, don't delay. Please come forward today. Visit one of the more than 200 testing sites across the state. And indeed, if you believe you have symptoms and you think you need a test and you can't get to one of those sites, we will come to you. This is so important that we have the most accurate, the most complete picture of how much virus is out there, how it's presenting, what are the stories that sit behind each of those positive cases, so that we can plan with that sense of steadiness and safety as we take these next steps. There are 4,273 cases with an unknown source. That's an increase of 3 since yesterday's report. There are 64 healthcare workers who are active cases. I thank them for their work. I wish them well. And I thank all of their many tens of thousands of colleagues who do quite amazing work every single day. There are no additional cases in regional Victoria. There are 9 active cases in regional local government areas under the 3rd step. The metropolitan rolling 14-day average as at the 26th of September is 22.1 for Metro Melbourne and just 0.6 for regional Victoria. Just quickly before I come to some other very significant announcements, for completeness sake, there are 209 active cases that are connected to aged care. There are 5 active cases that are connected to disability facility settings. Now,